information on today's topic and more, check out thecheerdoc.com. Ready? 5, 6, 7, 8.
What's up, guys? Thank you so much for joining us. Today I want to talk to you about a very, very common condition that we see not only in cheer, but also in other sports across the board. Recently, we had a video that we posted where an athlete was working on a back tuck. We gave her some pointers. We did a game film video of her tuck. And one thing that I noticed that I spoke with her about a little bit was she wore a couple of things that looked really, really, really familiar. And these are straps that were worn around the front of her knee. Now, these straps are for a condition called patellar tendonitis, or jumper's knee. And this is exactly what I dealt with when I was cheering when I was younger. And so I dealt with this condition for about 8 to 10 years, and it's pretty bad. It's very, very painful. Now, if you've ever had jumper's knee, you may have had these straps recommended to you in the past. Basically, what you do is you wrap the strap around your knee, you cinch it tight, and you Velcro it down. And for some reason, they work really, really well. Well, the reason that they work really, really well is because when you compress the tendon in the front of your knee, the tendon that you get your reflexes checked, when you compress that, it overrides the pain signal to the brain. There's a really cool mechanism in your brain where certain stimulus makes it to the brain faster than others do. It's very similar to if you ever burned your finger, or if you smashed your finger either in a door or with a hammer and you started shaking it really hard, or if you started sucking on it really hard and it made the pain go away. And what you're doing is you're overriding the pain signal with a either vibration signal by shaking it, or with a pressure signal by sucking on it. That vacuum or suction pressure decreases the pain. And so the patellar tendon wrap does the same thing. It applies pressure to the tendon, and that overrides the pain signal to the brain, or it beats the pain signal to the brain, makes it there faster, so you feel that versus the pain. Now, what I want to talk to you guys about is, instead of having to rely on these things like I did and a lot of other athletes do, we should be addressing why we have this pain in the first place. Now, when we have a patellar tendonitis or a patellar tendinopathy, what that is we have overloaded the patellar tendon and it's become irritated. Now, if that happens in a very short period of time, it's a tendonitis or an inflamed or irritated tendon. But if we let that go untreated, it becomes a tendinosis, which means it's a chronic tendon injury that the tendon does not repair itself properly. Now, typically this is going to be associated with overuse, right? So we're over-dominant with one area versus the other. So for our sport, and we've talked about this numerous times, typically your cheer athletes are going to be quad dominant or quad strong, and hamstring non-dominant, or flexible but not very strong. And when that happens, we put more force or more load onto the thighs, which all loads that patellar tendon, or that big tendon that's in the front of your knee. And so when we're dealing with this type of injury, the research shows if you don't work on this injury, so if you don't treat it and rehab it, rest alone will not help. It's one of those things where if you rest, you could rest until you feel some discomfort relief, but the second you start to load it again with activity, that pain is going to come back in full force. So when we have this pain in the front of our knee, this jumper's knee or patellar tendonitis/tendinosis, it's not something we want to ignore. The other thing is, it's very frustrating because it is so painful, but for the most part, it's not an injury that we're concerned about having structural failure. It's very rare that you hear of someone blowing out their patellar tendon. Now, it can happen, but it's very, very rare. So in order to address this, we have to figure out what is the cause of this pain. Is it simply an overloaded thigh muscles or a group of thigh muscles, your quads, that's putting too much load on the tendon? Is it a little bit more complex than that? Do we have true weakness in the hamstrings, in the glutes, or your butt muscles that is not allowing us to create balance and movement? So the other day we posted a video about foam rolling on your thighs to help alleviate knee pain in the front of the knee. And that's a great place to start. Foam rolling your quads to help relieve tension there is a fantastic way to start this process. And additionally, we've shown some other exercises to increase hamstring strength. And when we look at pairing these two things together, relieving quad tightness, increasing hamstring strength, we usually can see a pretty good response when it comes to pain in the front of the knee. Now, additionally, ice, always a great option when you have pain. The front of the knee, depending on how long it's been there, you can probably play with some ice on sometimes and some heat on the other. You know, heat before, ice after, or contrast, heat before activity, ice after activity, or you can play with contrast therapy where you would do, heat, ice in one sitting. So not before or after, but just back to back. The thing with patellar tendons are that they take quite a bit of time to fully repair. So this isn't one of those things where, 2 weeks later we're like, yes, 100% ready to go. We have to modify the volume that we're doing, so decrease how much activities we're doing in cheer while we're working on this rehab. But the most important thing is that we're addressing the reason why we got it in the first place. If that is just tightness in the quad, we have to work on that. If it's a combination of a few things that are affecting, your overall functionality as an athlete, we have a lot of movement imbalances, it may be a little bit more challenging, but we have to address that all. Because without addressing it all, there's going to be some small piece that may keep us from fully recovering. And on top of all of that, and I had this conversation with some patients earlier this week, if you do nothing, doing nothing is doing something. It's nothing, but you're actively doing nothing. That's still doing something. And the definition of insanity, right, as we all know, is doing the same thing over and over and expecting a different result. So if we do nothing over and over and expect to have a different result, like less pain, that's literally the definition of insanity. So we have to keep this in mind when we have pain in the front of our knee, or pain anywhere else really, is if we're not doing anything, we should not expect to get a result that's favorable. We have to do something to improve the quality of that part of our body, bring up the strength, decrease the injury, or else we're going to be stuck with the same injury for a really long time. Hope this was informative for you guys. If you have questions about knee pain specifically, shoot us a message. We'll help guide you to a provider that can help you to determine what exactly is causing the pain that you have so that you can get that alleviated. Hopefully you don't suffer with it like I did for almost a decade. Hopefully you're able to get this thing figured out. Have a wonderful rest of your day, and we'll talk to you soon.
Thank you for joining us. Be sure to check out thecheerdoc.com for more content. Also, if you found the material today valuable, please subscribe, rate, and leave us a review. It's very much appreciated. Thanks for listening, and have an incredible day.